Welcome to Medicine Handy Point. Today we'll discuss the clinical signs in diabetic patient. Very important topic from clinical point of view and from the exam point of view as well. So let's start. So when a diabetic patient comes, we have to look at the general appearance of the patient. Type 1 diabetic are usually cachectic, mean they are thin lean, while type 2 diabetic patients are usually obese. Then we'll look at the pigmentation. If there is generalized pigmentation, keep in mind that Brown's diabetes, which occurs because of the hemochromatosis. Now focus on the face. Cushing syndrome can cause diabetes. Acromegaly can cause diabetes, while thyrotoxicosis can also cause diabetes. So you can see from the face whether the patient is Cushing-guide, acromegalic, or thyrotoxic. Then we will look if there is any air discharge. In diabetes, infections are common, so air discharge is also common. Corneal arcus can be present in the eyes, xanthelasma around the eyes. Ocular palsy and Bell's palsy can occur in diabetic patients, so during inspection look for those stuff. Oral cavity candidiasis may be present, and in the neck look for thyromegaly, as thyrotoxicosis can cause diabetes. Now in the neck and axilla look for acanthosis nigricans, which is the dark brown pigmentation of the axilla and the neck as a result of insulin resistance. Now we move to lower limb. In lower limb, check the skin for vitiligo, as it is also autoimmune problem, and diabetes type 1 can especially is autoimmune problem. So check for white patches on the skin. Check for diabetic dermopathy. Dermopathy is brown macular papular rashes present on the lower limb. Look for granuloma annulare, which are basically in nodular lesion in circular pattern, so it can be seen in the diabetic patient. Look for necrobiosis lipoidica diabeticorum, which is actually yellowish discoloration present on the shin of the diabetic patient with some induration, can be seen especially in diabetic patient. Then look for cellulitis, boil and carbuncle, which are very common in diabetic patient. Look for skin atrophy and hair loss. Look for fat atrophy or hypertrophy at the injection sites, especially in the thigh. Look for the fungal nail infection common in diabetic. Examine now the musculoskeletal system. So we are done with the skin stuff. Now musculoskeletal. So in musculoskeletal, there is muscle wasting in the thigh, which is called diabetic amyotrophy. Look for callus formation, hammer toe or claw toe. Hammer toe and claw toe are because of the atrophy of the intrinsic muscle of the foot, which leads to hammer toe and claw toe, which occur in diabetic. Look for Dupuytren contraction, trigger finger, especially in the upper limbs. Look for joint deformity, Charcot joint, especially in the ankle and the knee joints. It can occur in diabetic. And never forget to check the ankle reflex. Ankle reflex is lost in diabetic patient. We can do that in neurological examination as well. Next, we have to examine the neurological system in the lower limb, especially in diabetic patient. Never forget again the ankle reflex, very important. Then examine the cardiovascular system of the patient, and for the cardiovascular system, feel the peripheral pulses which are reduced or absent. Check the postural drop, which is present in diabetic patient. Auscultate the carotid for bruit, because the bruit can be due to atherosclerosis of diabetes, and auscultate or the heart for the fixed heart rate, which occur in diabetic patient. I hope you like the video and please subscribe.